By definition, concussions are brain injuries, and fears about their lasting impacts might be the NFL's biggest existential problem. It's an issue the league has tried to address and really hasn't been talked about a lot in recent years, but boy, that all changed last week when Miami Dolphins quarterback Tua Tagovailoa suffered at least one significant concussion and possibly more. We do want to warn you, some of the video a little later in this story could be upsetting for some of you to watch. You didn't need to be a doctor to know something was wrong with Tua Tagovailoa after hitting his head against the Bills. He had trouble getting up, then shook his head before his legs gave out. Initially, the team said it was a head injury, and sports neurologist Dr. Stefanie Alessi-LaRosa from Hartford Healthcare said those symptoms were consistent with a concussion.
That sign alone, it would give me pause.
But the Dolphins later said it was a back injury and let Tua back in the game. Thankfully, he wasn't hurt. But the Dolphins' next game was only 4 days later. If that was a concussion, Dr. Alessi-LaRosa said that would be far too soon to play.
Typically, it's 7 to 10 days, certainly by 2 weeks, that the brain should recover from an acute concussion.
And many people, including at least one concussion expert, were convinced he was concussed. Dr. Chris Nowinski, the head of the Concussion Legacy Foundation, sent out a chillingly prescient tweet before the Dolphins played the Bengals Thursday, saying Tua shouldn't take the field and could be risking his career or even his life by doing so. Why? Second impact syndrome.
When you have a concussion, you are more vulnerable to successive hits while recovering from that injury. So this is really the basis of second impact syndrome, which is sort of a feared complication of concussion where the brain can rapidly swell and, can cause coma or death.
And just hours later, Tagovailoa undoubtedly suffered a concussion. What gave that away was the unnatural and unconscious posturing of his arms and hands after impact. It's a primitive reflex to a brain injury that's called the fencing response.
A fencing response is something we don't want to see as a sideline physician. It really is that there's an unnatural position of the arms and hands in response to head trauma.
And while the fencing response is an immediate sign and an obvious sign that an athlete needs to be removed, the question people are now asking is, why isn't it the same when a player can't even stand?
Any response like that or objective physical findings, really they should be removed from play.
And just last night, in the other Thursday night game, Nyheim Hines, a running back from the Colts, had that same problem where he just couldn't stay on his feet. It's called gross motor instability. Your major muscles aren't even working. They took him right out of the game. Well, since Tagovailoa was hurt, a neurologist who examined him after the first injury has now reportedly been fired, and the NFL's Players Association is investigating. By the way, Tagovailoa has not yet been cleared to play, and it might be a number of weeks before he is. We certainly hope